Hi, good morning, everyone. This is Lane Tassan, Chief Medical Officer for FastMed, CareSpot, and MedPost. Before we begin the webinar, I want to remind everyone that you're on mute. If you have some questions, you can enter them into the Q&A box on your screen. And we'll have a presentation of 30 to 35 minutes and then follow up with a question and answer period. So it's my pleasure this morning to introduce Dr. Shane Crotty. As included in the biography attached to the invitation to this webinar, Dr. Crotty has an impressive educational background at MIT, University of California, San Francisco, and Emory universities. About 18 years ago, he established and has since led a laboratory at the Jolla Institute for Immunology. He's published over 150 scientific papers on the topics of virology, immunology, and vaccines. I watched some of his webinars this past weekend and was very impressed about how he can explain complicated topics in a way that everyone can understand them. So in short, he's a really smart guy, and we are lucky to receive the benefit of his knowledge and experience this morning. So I'll turn the webinar over to Dr. Crotty for his presentation.
Thanks, Lane. That was a very generous introduction. Thanks for having me. As you said, I'm gonna talk for a bit about COVID vaccines, and their safety and efficacy, and then we'll have some Q&A. I'm at the Jolla Institute for Immunology here in California, and we're on the campus of the University of California, San Diego. We're a nonprofit research institute studying the immune system, and my expertise generally is viruses and vaccines. Me, along with my colleague, Professor Setti, had the first major scientific paper on immune responses to this virus, to the novel coronavirus. Here's the front page of that paper, and it's been widely influential in the scientific field. Or if you prefer a live action version of the paper, here's Tony Fauci holding up a copy of the paper in Congress as he attempted to explain T cells and immunity to congressmen. We've also published on immune memory, how your body remembers either the coronavirus infection or a COVID-19 vaccine. And we actually did the largest study ever of its kind for any viral infection, and it got a lot of attention in news around the globe, and it's actually still getting a lot of attention in news around the globe 9 months later. And here's our most recent study, which came out in the journal, scientific journal Science 2 weeks ago, which is the first study to actually measure T-cell memory to the Moderna vaccine, in particular a low dose of the Moderna vaccine, and compare it to some different things, including age and natural immunity. And I just list those so that you have some idea of the types of science that I've been involved in. In terms of trying to help out to explain vaccines, I've done a number of outreach things. This one in particular, this group called MedCram on YouTube asked me to do a video with them, and they do some really nice videos. So I said yes on explaining COVID-19s and COVID-19 vaccines and safety. And it's been seen over 2 million times, which was just incredible. And it's like a 30-minute video. So I told my kids, I was like, hey, I got this YouTube video. It's been seen, over 1 million times. I said, people only watch the first 10 seconds. But they actually checked the metrics on it, and actually like 500,000 people have watched the whole thing. So there you go. It seemed to be pretty good for helping to explain things. And so today, I'm gonna really focus on these two main points. COVID vaccines are safe for you, and COVID-19 disease is not safe for you. And then, as discussed, we'll open up to Q&A. Some of the things I'm going to talk about are definitely questions that I frequently get, right? So I'm answering them as part of this presentation, but I'm happy to go back to them, okay? If you want me to repeat something that I said because I was going too fast or explain it further, totally happy to. Just I'll try and get through some of these things relatively quickly so that we have time for the Q&A. So I'm going to start on COVID-19, the disease. Where we are now with the Delta variant. It's really, at this point, you're either vaccinated or you're going to catch Delta. It's so infectious. It's infecting essentially everybody who's unvaccinated. And whether you're a young adult or old, when you catch Delta unvaccinated, you really have the highest chance of being hospitalized compared to almost any disease you've caught in your life. Okay, it is that nasty, and a lot of people don't realize that. It's really sad that really right now and for most of the past month, almost 2,000 Americans have been dying every single day of COVID-19, with a disproportionate number of those coming from Florida, among some other states where I know you all are active. And some people say, well, I'm not gonna catch COVID, or I'm healthy, so I'm not gonna die from COVID. But COVID hospitalizations are a really big deal, and it's a really common misconception. People think that only people over the age of 65 are at risk of hospitalizations. That's not true. Half of COVID hospitalizations in America are people under the age of 65. And here's data on that. Half. So it's over 1 million Americans under the age of 65 have been hospitalized. And that's not just some funny cutoff where all those people are 64 or something. Half of those are people under the age of 50. And so it really is quite nasty at causing hospitalization in any age adult. And many of those people who get hospitalized or close to hospitalized actually end up with long COVID. Long COVID is very real, and it can be quite bad. I mean, people are out of work for months with brain fog or inability to walk upstairs or inability to go to work or focus on work. And the vaccines prevent this, okay? The vaccines prevent essentially all hospitalizations, almost all hospitalizations in all cases of long COVID, because they either prevent the infection or they minimize the amount of the infection. So by minimizing these other risks, okay? The vaccines work. So Associated Press did an independent analysis and said, okay, of hospitalizations, how many of these are breakthrough cases in fully vaccinated people? And so it was about 1%, right? So 99% of the hospitalizations were unvaccinated people. And same thing with death. Over 99% of the deaths were unvaccinated people. That was in May. And here's, oh, wait, there we go. That was in May. And now since the Delta variant, what's the status? And the status is the vaccines are still working really well against the Delta variant. They're not as perfect against the Delta variant as they were against Alpha, but they still work incredibly well. And so in the era of Delta, I'm in San Diego County. And so I follow both national numbers and San Diego numbers. And so here's the totality of San Diego County, which is a large county, right? Hospitalizations in the era of Delta. And there were about 535 hospitalizations. Almost all of them were unvaccinated people. There were a total of 13 people out of those 500 and something that were actually fully vaccinated. The vaccines work. They work incredibly well, and they work very well against Delta. That was hospitalizations. What about deaths? Yeah, almost in the period of Delta, again, almost all the COVID-19 deaths are unvaccinated. which is really sad, right? Because we're at a point where about 2,000 Americans are dying every day, almost all of them unvaccinated, and therefore, essentially, almost all of those 2,000 deaths every day are vaccine preventable deaths. These are also associated with locations that have low vaccination rates. So areas with lower vaccination rates have a lot more transmission, have a lot more cases. Here's a pretty simple graph of this. So the percent of a county, right? So county level here is useful. The percent of a county that's fully vaccinated compared to the number of infections in those counties. This was a little bit earlier. And so you can see basically these counties that have these huge spikes in infections are counties that are basically failing to get sufficient numbers of people vaccinated. And that's also happening with the deaths. And so that's where this term pandemic of the unvaccinated comes from. Whether you look at deaths, hospitalizations, or cases, the vast majority of these in the United States are occurring in unvaccinated individuals. And so something that I hear from time to time is that, well, but I hear some vaccinated people still get COVID, so the vaccine didn't work. And actually, it's literally the opposite of that, okay? And when we know this from the blinded clinical trials and the way of crunching those numbers, if you got vaccinated and you still got symptomatic COVID, you're one of the most important people the vaccine was working in, because you got symptomatic disease. If you hadn't been vaccinated, you would have gotten a lot worse off. So if we look at unvaccinated people who get COVID, there's a spectrum of disease that you get, right? Some people get asymptomatic, some people get a few minor symptoms, or cold-like or flu-like, and then you've got the 10 to 15% that end up hospitalized, ICU, or the fatal cases, okay? And then the vaccinated group, and the same, most of those people never get infected. So most of these parts of the infection are just completely blocked. But of the people who do get infected, the likelihood of these very severe outcomes is still incredibly small. Right? And so if you got vaccinated and you still got flu-like symptoms, that means you probably would have had a very serious infection if you hadn't been vaccinated. Your immune system is protecting you much better than you would have been otherwise. And it's also pretty straightforward to crunch the numbers of that the COVID vaccines have already saved 200,000 lives in the United States. Okay, I mean, these are just incredible numbers as how big of an impact COVID-19 is having on our lives overall, and how much of an impact the vaccines are having, both on preventing deaths and preventing hospitalizations. And actually, these numbers are even bigger now because the Delta wave got bigger. So that's the summary of the vaccines and COVID-19 disease. So now we'll go to safety. Okay, I actually got involved in this Thanksgiving last year, Thanksgiving Day last year, where I had been working about 200 days straight at that point on COVID-19 research. So I was taking the day off for Thanksgiving, you know, hanging out with family. But I realized there had been a lot of stuff in the news about RNA vaccines, and it was pretty confusing. And so I ended up writing a Twitter thread trying to explain how the vaccines work and what the safety data meant. And so that actually got millions of views on Twitter and got picked up all over the world. So I did not successfully manage to take the day off on Thanksgiving. And so what are the simple ways to understand how RNA vaccines work and what the safety data mean? Okay, and the first is to be really clear about what an RNA vaccine is. And I'm happy to talk about J&J also later, but since most people get the RNA vaccines, I talk about that. So RNA is messages, okay? Sometimes people will use the phrase a genetic vaccine, and I think that's a poor way to phrase it, because the RNA is messages. At any moment any given human cell has about 5,000 different RNA messages in it, okay? And these are all temporary messages inside your cell. And they're like Post-it notes that get torn up by the cells within minutes or hours after being read. That's what RNA is designed to be. Temporary messages giving the cells an instruction. Or if you like, RNA is more like Snapchat. They're like Snapchat messages that they expire. They don't become permanent parts of your body. They're temporary messages instructing cells to make one viral protein temporarily, and then they get chewed up and destroyed. Speaking of that one viral protein, in the case of these RNA COVID-19 vaccines, the RNA message is for one single coronavirus protein, and that's the spike protein. It takes 25 different coronavirus proteins to make a coronavirus. So there's no worry about the RNA making a virus. There is no virus in you. There's just 1 out of 25 pieces. Okay, and that one piece is being shown to your immune system, so your immune system can learn about what the virus looks like before you ever come in contact with the virus. So it's literally like going to class and an education for your immune system. Right? So lastly, safe does not mean the same thing as didn't hurt at all or no fever for a little while. The immune system tends to only remember things that at least hurt a little bit, that are some sort of insult, and really. It's really quite like going to the gym and getting exercise and getting really sore muscles, right? So the fact that you end up feeling sore the next day after you go to the gym, you go, ooh, that hurts. But you go, well, actually, that's a good kind of hurt, right? I was working on my muscles and I was getting better, and that's my body getting better. Vaccines, same thing. A bit of that can be a positive sign that good things are happening. A fever is a sign of your immune system getting activated and paying attention to this vaccine that you just got, for example, as well as the aches and pains. And, it's not fun, but sometimes you have to earn your immunity, just like you have to, earn those biceps or whatever your favorite muscle is that you are going to the gym for. So in terms of actual safety data, right, what's the safety data for these vaccines? The Moderna and Pfizer RNA vaccines have incredible safety data. Okay, there were 30,000 people in the Moderna clinical trial, 40,000 people in the Pfizer clinical trial. Each of those were monitored by an independent safety monitoring board for each study separately. The company has no control over that safety monitoring board, and those have been going for about a year now. And so, actually, this amount of clinical trial data on safety is more than any medicine you have ever received in your entire life. Okay. This is literally, this is probably the best safety data of any medicine you've ever had in your entire life. Because in the interest of getting results relatively quickly, these clinical trials needed to enroll very large numbers of people because the endpoints of the trial, right, were how many people get infected. And so you have to enroll lots and lots of people so that you capture, right, a certain number of infections. And then the fact that these were independent vaccines, right, that came to the same conclusions being monitored in independent clinical trials is a pretty incredible sign of the robustness of the safety of those vaccines. And the Pfizer vaccine has now received full FDA approval, and we'll come back to that. Come on, next slide. There we go. And overall, there have been hundreds of millions of doses of these vaccines given in the US. So this was, I updated this slide last week, right? And so there have been almost 400 million doses of these vaccines, and they've had an incredible safety record, and overall 6 million shots given worldwide, which also has been a pretty incredible safety record associated with them. In terms of the vaccine clinical trials, sometimes people said, well, but did the vaccine clinical trial include people like me, right? Was it tested to be for safety in people who are like me? And these were actually some of the most inclusive vaccine trials, or actually any medical trial ever in any country for any purpose. Excellent efficacy and safety in people over the age of 65, men and women, Black people, and Latinos all had excellent representation in these studies. Okay. Also, simply by the fact that these trials were so huge they actually ended up including a significant number of pregnant women. Just like any first-time clinical trial, pregnancy was an exclusion from the clinical trial. If you were already pregnant at the start of the trial, you were not allowed to enroll. But given there were so many people in the clinical trial, there were some inadvertent pregnancies during these vaccine tests, and that data were collected. And in fact, and for each of these independent clinical trials, so for the Moderna and the Pfizer and the J&J, and in each case, the safety looked great. Actually, the pregnancies looked totally normal. And so even at the time, the FDA said, they agreed, yes, that safety data was sufficient so that pregnant women could get vaccinated if they wanted to. And since then, there have been large studies tracking safety in pregnant women for each of these vaccines. And because of that, the FDA has formally approved the RNA vaccine for pregnant women. And the CDC now actively recommends the RNA vaccines for pregnant women. And that's because quite a few pregnant women in the US have died from COVID-19 disease. And so it's been recognized that it is actually important to protect pregnant women from this disease and do so by getting them vaccinated. So it has been shown to be safe in pregnant women, and it is quite effective in pregnant women. There's no effect of the vaccine on pregnancy or fertility. We can come back to this, but there's a lot of data in those trials, and it's fine. People like to get their information from different authority figures, different people that they trust, and I just want to point out that it's pretty exceptional how broad vaccine approval is amongst these individuals. Certainly medical authorities in the US, like Tony Fauci, have been big supporters of the vaccine. The Pope, from very early on, has said ethically everyone should take the vaccine, and he literally said there's a suicidal denialism that I wouldn't know how to explain in terms of people being anti-vaccine. And he said, today you need to take the vaccine. And President Trump was vaccinated in January, recommends vaccination, and for what it's worth, all the Fox News hosts, irrespective of what they actually say about stuff, they've been fully vaccinated for months. Okay. And so you'll see people say things like this, you're like, well, if you've seriously looked at the available data, these vaccines are incredibly safe, incredibly effective. Again, 2,000 Americans a day are dying from COVID-19. So clearly people should get vaccinated. And they're incredibly safe, compared to 4 million people dying of not getting vaccinated. And this is where people go, well, wait a minute. If they're so safe, why do I hear so many bad things about them? And this is where there's really unfortunate confluence of events. But essentially, it's just a whole bunch of made up stuff online. And a lot of this actually comes from about 12 sources of misinformation, okay? And out of millions and millions of posts on Facebook and other platforms, right? Most of them track back to 12 accounts, literally millions of posts. And those posts are literally just fear-mongering. They literally go through a list of what could I say that would scare people the most, that would get the most clicks? And they're like, I know, it's easy to scare people about pregnancy. So let's say that the vaccines prevent pregnancy or make it go wrong. Totally made up, no data at all, but it got really popular because it was scaring people. And then same thing with male sterility. I was like, okay, what can we say that scares men? Sterility, that definitely has become really popular online. Totally wrong. Not supported by data. And in fact, turns out, death is another way, obviously, vaccines causing death is another way to cause disinformation. But turns out men, at least based on clicks, are more scared of the sterility than death. So, go figure. And the way this works is look, the more clicks these people get, the more money they make. Facebook literally makes millions of dollars off of all of these clicks. And so the more scary people can make stuff, the more clicks they get, and the more money that gets made. I mean, that's just the truth. So like one of those top 12 sources is this guy, Mercola, okay? And he's been doing this kind of thing for like 15 years. And most of the posts you see in the end, they've been remade by people over and over again, right? So they're no longer associated with this guy's name, but he actually made a bunch of these. And, you know, going back, here's him with Dr. Oz talking about cancer can be cured with eggplant, you know, stuff like this. That's the kind of thing that is being peddled. The other one that you may come across is that's been widespread online is posts saying, well, based on the official government VAERS database, there are lots of horrible vaccine side effects. And unfortunately, this is a fundamental problem with this database. This is an open database that anybody can add reports to, okay? So, and anti-vaxxers figured this out years ago for some other vaccines, and then it just became really intense with COVID-19. So they were literally adding thousands of fake entries every day this summer, including like 1,000 fake deaths and all kinds of reports about kids and side effects that couldn't have been vaccinated because they were kids in the wrong age groups. And so the way this works is, my favorite example of this is the Incredible Hulk. So somebody went in and just said, hey, you know, I got vaccinated and then I turned green and I got huge and I got super strong. And that was in this database. And so if you did a search for side effects of the COVID vaccine, you would turn out that, oh, sometimes the COVID vaccine turns people into the Incredible Hulk. There's no filter. Anybody can add whatever they want to that. And then it takes the CDC like 6 months to go through and find any of those fake reports. So there's plenty of stuff you can find online that right now that says, hey, the VAERS CDC database itself is showing that there are all these horrible side effects. And unfortunately, that database just can't be used for that reason. It's just full of all kinds of fake reports, okay? And the other, I think, most common thing that I hear about as a reason for people being hesitant about getting vaccinated is, well, hasn't it been so fast? It really hasn't been long enough to get enough information about are these vaccines actually safe? And that's a fair question. And here's why there's so much confidence in the safety. Okay, so first, as I mentioned before, there are these benefits of having these massive clinical trials. Because they had to enroll so many people, it's actually an incredible amount of safety data. Again, probably the most safety data from clinical trials, which are blinded, right, placebo-controlled. So that's the best place to find real safety and side effect data. This is probably the most of any medicine you've ever had in your life. And then in addition, because there's been this massive global vaccination effort, right, with hundreds of millions of doses in the US and then 6 billion doses worldwide, there's a massive amount of real world safety data, much of which has been captured in various medical observational studies, showing that these RNA vaccines, they're just incredibly safe. And in terms of long-term, so Dr. Prof, it's probably the biggest medical expert on this in the country. And he and I very much agree on this point that, the reason 2 months is enough for an emergency use authorization and 6 months is plenty for full authorization is that there are no long-term side effects where you find, 1 year, 2 years later, some kid or a person develops some problem that wasn't picked up initially. It just hasn't ever happened for vaccines before. And that's actually true for most acute medicines. That is, a medicine you get like 1 dose or 2 doses for, okay? The medicines that you really have to pay attention to for long-term side effects are medicines that people go on daily doses of, right? Or they're repeatedly taking every day or every week for years at a time. Then you have bigger challenges with toxicity and side effects of things that can accumulate. But short-term exposures, 1 shot, 2 shots, whatever it's going to do happens quickly, and you can see that. Okay, And so that's why the FDA approval, they require full 6-month vaccine safety data to make sure it's all good for the 6 months. That's been submitted by Pfizer and approved. And that data has now been submitted by Moderna as well. It's just the Moderna trial was a little bit behind, it started a little bit later. Its safety data is just as good as the Pfizer data from everybody who's seen those data. And now, honestly, it's simply a matter of paperwork. It takes a while for the FDA to go and look through and double check all of these things. So briefly on the J&J vaccine, a lot of people prefer the J&J vaccine because it's one dose. That's fine. It's not as effective at preventing symptomatic cases, but it's really effective at preventing serious disease, hospitalizations or deaths. So the J&J vaccine, totally a good vaccine. It's also got proven efficacy against one of the worst variants, the beta variant. So great vaccine. Feel free, to use that one. They're probably going to convert that to a 2-dose vaccine. That data should be out pretty shortly. And what about J&J vaccine safety? Big clinical trial, lots of safety, and follow up through those. They've seen there are rare side effects at about 1 in 2 million people, maybe 1 in a million, primarily in women of childbearing age, which is why the RNA vaccines are generally recommended in those groups. But largely, if this is recognized, it's also a success. There's a successful treatment for it, so it can be dealt with. And in terms of side effects, people sometimes struggle with these numbers. What does this number mean? How common is that? And so, I like to put it in the context of other things people do in their daily life. So the likelihood of someone being in a fatal car accident this year is about 1 in 30,000. So basically, if you're not changing, if you're not avoiding driving, right, then you're essentially saying, risks lower than this aren't really relevant in your daily life, and this is a lot lower risk than that. So those are the types of numbers that safety officials keep in mind when trying to consider what's acceptable safety. It's a lot safer than driving around in cars, for example. An additional one that's come up recently is discussion about vaccines having fetal cell line material in it, or other stuff. And just to be clear, the RNA vaccines do not contain metals or fetal cell line material. And that's a reason that the vaccines are fully recommended by all major religions in the world. And here's a reverend in Texas talking about this for Christians, which we can come back to if you want. I have another, yeah, and just, so overall take-home message there, from my perspective, look, getting immunized, it's the kind thing to do. It helps you, helps your loved ones, helps your neighbors, helps your community. Variants, people have said, well, wait, do the vaccines still work against variants? Yes, the vaccines still work against variants. There are measurable differences, and so there are things that scientists like myself are paying attention to consider how the vaccines are going to do, longer into the future. But big picture, I love this Scientific American article. Your immune system's really built to deal with variants. It's very good. And your immune system has multiple different parts to the immune system that each deal with variants in different ways. And so you have these multiple backup systems for dealing with variants. So a variant might be different enough so you still might get a little bit of an infection, but the vaccines are still completely just as good at preventing hospitalizations and deaths against variants as they were against the original virus. And the data are very robust on that. It does, you do need both vaccine doses for the RNA vaccines. And finally, I usually like to talk about, it's useful to think about the nature of a given viral infection for understanding how do you get immunity to it and how does the immunity work, okay? And it's really quite reasonable to think about this as it's all a race. It's a race between this virus and your immune system, okay? And this is a virus that replicates really fast in the nose and the mouth, but it's a lot slower in the lungs, okay? And so that's why We talk about transmission in 4 days or 6 days. That's all up here. But when we talk about hospitalizations, we talk about day 21 hospitalizations. And that's all about the lung infection, the pneumonia, resulting in hospitalizations and deaths. So these symptoms are all about the nose and the mouth. And then the hospitalizations and deaths are all about the lung. And it's a race. And if you get infected, you know, some people lose the race with the lung infection. But with the vaccines, vaccines change the race. You have the head start instead of the virus. If you just get infected, now your immune response has to start from scratch and catch up to the virus. But if you've already been vaccinated, you've already got all this immunity. And you've now got 21 days for that immunity to keep the virus from getting into the lung or killing off the virus in the lung. And so that's why the vaccines might not be perfect at stopping the nasal infection, but they're really close to perfect at stopping the lung infection and the death, because this is a lot slower and your immune system has all the advantages here as long as you've been vaccinated. Okay. And I did a podcast on this that people have liked. And so if you want that, that's available here. So that's it. These are the points that I wanted to cover, and we'll go to the Q&A now. And a couple of questions were submitted in advance, and one of them was essentially, but I've already had COVID. You know, why should I still get vaccinated? The recommendation is still get vaccinated, and for these 3 reasons here. Okay, it's way too common that I find people who think they were previously infected when they were not. They didn't actually have a positive test. They didn't have a positive antibody test. We actually had a police officer here in San Diego die just the other day, and he was unvaccinated, and he said he was unvaccinated because he thought he got COVID, a while back, but he didn't actually have a positive test or anything. He just, had some symptoms and thought that was it. And that's one of these horrifying things, that we're really trying to prevent is this scenario. But even for people who do previously have documented infections, some people there's been a lot of misinformation online that the vaccines aren't safe for people who have been previously infected, i.e., this VAERS database stuff, people saying that people have died. That's totally untrue. The vaccines were checked for safety in previously infected people, both in the full clinical trials. The Moderna and Pfizer clinical trials actually had people enrolled who'd been previously infected. They were totally fine. And there have been a whole series of observational studies separate from those, and they've been safe. Usually people who've been previously infected, they have more symptoms after the first vaccination, whereas people who haven't been previously infected have more symptoms after the second vaccination. But overall, they end up about the same. Okay, so they're definitely safe. And the vaccines are incredibly effective in previously infected people. If you want to be sitting next to somebody all day, you really want it to be somebody who actually was previously infected and got vaccinated, because as I summarized in this little article in Science, people with natural immunity who get at least 1 dose of vaccine have this hugely improved immunity. It's like 20 to 100 times better antibody responses, and it recognizes basically every variant anybody's ever come across. And so people who have been previously infected that get at least 1 dose of vaccine have really outstanding immunity. It's a great thing to do, and those people are probably protected for a really long time. So okay, so now I will open it up to other Q&A. And Lane,
Okay.
I don't remember, who was going to read the question?
I'm Angela here, the communications manager for FastMed, and I've been monitoring your questions, and thank you for everyone who's been submitting those either now or a few that submitted them beforehand. So thank you very much. And we're really grateful to have Dr. Crotty and his expertise to explain some of the questions that were asked. I think some of them have been answered as far as the FDA approval process, the natural immunity. I did have one come in that said that natural immunity can be up to 25 times more effective than vaccine immunity, and that also vaccinated patients can still carry the same viral load as an unvaccinated person. So is there...
Yeah, good.
Yeah.
So let's start with that first one of saying natural immunity is 20 times better than the vaccine. So that's been in the news a lot. That's really widespread, and that is based on a scientific study. That's a paper. That's a preprint. Sorry, that's a preprint out of Israel. I think it's going to turn out to be incorrect. Making those epidemiological conclusions depends on matching up people who have similar behaviors and similar histories, and there is a real science to figuring that out, to making sure you do those calculations. And it's turned out to be really hard to do that in Israel. There's a New England Journal of Medicine paper that spent months trying to figure out how to properly match up people in the demographics there, whereas it's been easier in certain other places, including England and the United States. And so to me, the best controlled study overall has been a study of like 300,000 people out of England that was randomized households and run by established epidemiologists. And what they found was that and the first author is Powell's, Powells. It's Oxford and a whole bunch of other places together. It's a huge national study that controlled for these variables. And they found actually vaccination is a little bit better than natural immunity. Which is essentially the opposite of the Israeli study. And that's actually been supported by observational studies in the US as well, that in general, the vaccine protection is a little bit better than the natural immunity. So there is a study out there, and I don't think that particular study is gonna hold up. I think the data from England and elsewhere are just better science, and that's why these recommendations are still being made. Sure, I'll go ahead and do the transmission one, and then there are several questions in the Q&A that I can go through. And this one's certainly a widespread one of people saying, well, if vaccinated people are just as contagious, why bother, sort of thing. And so that's incorrect. So CDC Director Walensky made a statement, something along those lines in July. Essentially it was a sentence taken out of context, okay? And so what she was trying to say was that in May, in the between times, with Alpha around, vaccinated people essentially never transmitted. It was just essentially perfect, right? And now it had shifted in the era of Delta. Delta is a virus that's more contagious, significantly more contagious. And there was now evidence that vaccinated people could transmit, whereas again, before then, it just didn't happen at all with Alpha. And so now, since July, accumulating more data and more studies, the conclusions are pretty straightforward. Unvaccinated people are at least 10 times as likely to transmit than vaccinated people. And so this is one of the reasons that it continues to be referred to as, a pandemic of the unvaccinated. And this is because vaccinated people, most of the time, they don't get infected at all. And so, if the vaccine is 95% protective, which is early, or if it's 85% protective, all of those people can't be transmitted, right? Because they never got infected in the first place, whereas the unvaccinated can. And then even in the vaccinated people, while the peak viral RNA amounts, the peak CT levels, as people refer to them, can be pretty comparable now with Delta between vaccinated and unvaccinated. It turns out if you do that over time, you find out that vaccinated people are infected for a much shorter period of time. And so they can transmit for a much shorter period of time. And then on top of that, there's only one study that's actually gone and tried to isolate actual infectious virus, not just quantify genetic material, but actually isolate virus from people's noses between vaccinated and unvaccinated. And they actually have a lot harder time finding it in vaccinated than unvaccinated, indicating that probably the virus is bound up by antibodies and stuff in the vaccinated. So even if it's there, it's not actually infectious. So overall, it's something like 10 to 20 times more likely that unvaccinated people are transmitting than vaccinated. So the vaccines are definitely quite effective at reducing transmissions. It's just not as perfect as it was with Alpha.
Okay,
Angela,
thanks.
sorry, go ahead.
Sure. Like you said, we have several questions here. Is the vaccine safe for those with autoimmune conditions? Would it activate the immune system inadvertently to adverse levels?
Yeah, that's a great question. And that's definitely one to talk with your primary care doctor, because autoimmune diseases includes a very wide range, right, of symptoms and causes. In general, the vaccines are safe in people with autoimmune diseases. Yeah, and that has been observed at this point. But there are certain individuals where it's definitely important to talk about specific symptoms and cases. And a lot of people with autoimmune diseases, it's actually quite important to get vaccinated because the vaccine is less inflammatory than COVID-19 is, right? And so, and people with COVID-19, there's a lot of scientific data now that COVID-19 infection, right? Infection with the virus can drive and exacerbate autoantibody responses and make it really bad. So some of the hospitalized people appear to be hospitalized because their autoantibody exacerbation by the infection. And so if you're autoimmune prone, it can be extra important to actually get the vaccine to keep the viral side effects from happening. But again, it does come down to the exact autoimmune condition that's being considered. So that one's done. Yeah, we did the vaccine developed too fast one. Is J&J, so next question was, is J&J as safe and effective as Pfizer and Moderna? And so that one, yep, that one I answered after this question was asked. It's safe, it is effective. It's not as effective at preventing symptomatic disease as the RNA vaccine. So if you want a vaccine that's going to do the best at preventing those cold and flu-like symptoms, you want to go with the RNA vaccines. If you're thinking, no, all I care about is not ending up in the hospital, and I really want to take a one-shot vaccine, the J&J vaccine works for that. That's fine. Let's see. All right, so I'll do the booster one, and then we'll go to the one. So I'm curious as to your opinion on the recent recommendation to only provide boosters for those 65 and older that place them at higher risk, or clinicians. Yeah, and you know what? I didn't include slides on boosters since that wasn't the main topic today. But I gave a talk specifically on boosters to the CDC and to infectious disease docs on Saturday, and that's now posted online, and I mentioned it in my Twitter feed. And in short, there is some evidence of waning immunity at 6 months after vaccination, and there's disagreement about how much of that is real or not, which is why you see scientists and public health officials with different opinions on it. Where there is consensus is that even if there is waning immunity out at 6 months after Pfizer in specific, because that's what the available data is, that waning immunity is about nasal or oral infection giving a little bit of an infection, okay? And so counting as a case, right, a positive case. There is no waning immunity in any of the US studies for vaccine protection against hospitalizations or deaths. The vaccines are doing just as well at preventing those lung infections, hospitalizations, and deaths at 6 months as they were initially. And my favorite data on that is actually the Kaiser healthcare system. It's a big healthcare system, right? They had a lot of data, and they had epidemiologists involved. And essentially that's exactly what they saw. They saw some, in their system, some clear evidence of waning immunity against measurable nasal infections, but no waning at all of the lung disease. And so the recommendation of boosters for people 65 and over has really been a better safe than sorry recommendation, that if there is some waning immunity later on that hasn't been caught yet in the US, but there's been evidence of in Israel, then okay, get vaccinated now and amongst those highest risk populations, right, as a better safe than sorry. Whereas everybody else, it still has a high level of immunity, and there's really no concern about it. And then healthcare workers, I think CDC Director Walensky got it exactly right, because everybody I talk to who works in hospitals is saying they have staffing problems, and part of the staffing problem is anytime somebody shows up with a positive test, right, even if it's asymptomatic, they're out of work, right? They got to go quarantine. And so hospitals are losing staff because of that, and because of staff not wanting to come in if their immunity is waning, right? So allowing boosters to those individuals, I think, is exactly the right thing, because it's going to boost their immunity back up to above what it was originally. So if it was 95% protection, originally, and it's waned some, it's going back up to 95% protection. And that third dose is probably giving good memory, so that there won't be nearly as much waning now. That usually after a third dose, antibody titers get sustained much longer. So that's why after a tetanus vaccine, after the second vaccination, you only have antibodies for months. But if you get that third vaccination, now you have antibodies for like 30 years. And so it's a positive thing for your immune memory, usually, to get that third dose. So I think that recommendation was actually spot on. The next one is, if I get an antibody test and I'm positive for COVID antibodies, should I wait to get the vaccine? Lane, you wanna answer this one first from a company policy perspective?
Yeah, the answer is yes. That as everyone knows, that our combined companies now have a vaccine mandate with a deadline of November the 1st. But I think the underlying question, whether or not a person should get vaccinated to begin with, is still confirmed by expert recommendations.
Yeah, and I think maybe the specific question is, if somebody got, well, so one scenario is somebody got infected last month and they tested positive. Should they get vaccinated now? And I think in general, the CDC recommendation is to wait about 90 days to make sure that the vaccine will take. Is that your in-house policy?
No, from what I've, the 90-day exclusion was primarily for people who received monoclonal antibodies or convalescent plasma. But unless those two criteria are met, a person can really get vaccinated as soon as they're done with their isolation period.
Okay, yeah, I'm fine with that. Let's see, how are providers able to tell that you've had Delta variant without having a Delta variant test? That one's is a great question, and it's a pretty easy one, because basically 90-something% of all the infections are Delta variant. Like in the UK, it got to 99%, and in some states in the US, it got to close to 99%. Essentially, all the virus in the US is Delta unless proven otherwise. So there are a couple other variants around, at a couple of percent, but Delta is just so infectious, it outcompeted all the other variants. All right, the next one. And Angela, if there's one you specifically want me to jump to, just interrupt me, okay? Otherwise, I'm just going to go through them in order.
Yeah, no, you're doing a good job. And just to let everyone know, this recording will go out. And you can share it with friends and family. So I know that's one there we can skip through.
So the next one is, what if I got the vaccine earlier this year, but test negative for antibodies? Does that mean I am no longer immune to the disease? Great question. No, that is not what that means. And I'm assuming you're saying you got the full vaccine regimen you should have, okay? I.e., if you were getting the Pfizer vaccine, you got both shots, or if you got the Moderna vaccine, you got both shots, or if you got the J&J, you got one shot. If you did that, and then you got tested for antibodies with some test and it was negative, ignore it. The CDC recommendation is don't use antibody tests to assess your immunity. A primary reason for that actually is that there are a whole bunch of different antibody tests, and they don't test for the same things. And some of them test for things that aren't even in the vaccine. And even the ones that do have different scales, they're not made to work with the vaccine. They're just not relevant tests for the vaccines. It's really Like I haven't had my antibodies tested. It's just not a relevant measurement. Essentially, everybody who got vaccinated, in those clinical trials developed really good immunity. That's what you need to know. There's certain special medical conditions where it's different, but that's the exception. Lane, I don't know if you wanted to add anything to that.
No, but I did want to contribute partly to an answer that you had a few times ago about the person
Sure.
about autoimmune conditions.
Oh yeah.
Is to remind them that their doctor, either their primary care doctor or perhaps their rheumatologist or immunologist, can request a consultation with the Clinical Immunization Safety Assessment, which is called the COVID-Vax project. If they have complex vaccine safety questions that are not readily addressed in CDC guidance documents, there is a special panel of experts that can help your doctor figure out if vaccination might be an undue risk for you as an individual.
Yeah, that's a great one, Lane. And I talked with a couple of those people on Saturday as part of the CDC call I did, and those people, they really know what they're talking about, right? They're dealing with these things all the time, and they've thought about these things deeply. Yeah, that's a great recommendation, Lane. Next, let's see.
Just for a time check, we have about 5 minutes. So we want to respect your time, but we will send out all the questions you guys asked if we don't get to them. But is there any couple that you see that you really want to answer, just so we make sure we get some really important ones out there? I think there's one here about the data for children with vaccines. Should parents be cautious about vaccinating their children? I know that's a little outside of the realm for our employees, but I think it's a question that's probably on a lot of people's minds.
Yeah, sure. So the Pfizer vaccine is approved for kids 12 and over, and they've now completed their clinical trial for kids age 5 to 11, 6 to 11. And that's been submitted to the FDA. And the information they've posted was that the vaccine was safe and elicited antibody responses that were at least as good as what adults get. And they went with a lower dose of vaccine, two doses, 2 shots, but a lower dose than what they used in older kids and in adults. And so all of that sounds very good to me, and the FDA has made noises that they think that data look really good, and so they won't commit to anything, but the expectation is they will have a decision before Halloween, and that kids in that age range will be able to get vaccinated starting at about Halloween or a little earlier. Younger kids than 5 or 6, sorry, I can't remember if it's 5 or 6, anyways. It'll probably be next year before there's sufficient data, but kids in that 6 to 11 age range, you can expect a decision by Halloween.
Okay, great. And there's one here. Is this a vaccine that you anticipate we will need annually similar to the flu shot?
Right, it's a good question. The companies talk about it that way, right? But they've got some motivation to say that, and that's why a lot of public health experts have been saying, look, we gotta take a look at the data and take a look at how long immunity is lasting. And so that's really the data that I was summarizing about the boosters so far, right? That out at 6 months, which is basically as far out as people have been in the US that you can analyze the data for. The vaccines are still working great at preventing hospitalizations and fatalities, and they're doing at least okay, depending on which data you look at preventing infections and minor disease. Okay. My expectation as an immunologist is that it's quite plausible that they're going to be 3-dose vaccines, and that you get your first 2 doses, and then you wait 6 months, 8 months, 12 months, something like that, and get that 3rd dose. And your immune system does a cost-benefit analysis, okay? It takes energy, it takes calories to make those antibodies, right, and to keep those T cells and B cells around for decades, which you do for the tetanus vaccine, measles vaccine, other vaccines. And so after 1 or 2 exposures of many vaccines, your immune system just doesn't consider that apparent infection to be that much of a threat, and just doesn't commit that much memory to it. But frequently after a 3rd exposure, your immune system doesn't know it's a vaccine, right? It thinks it was an infection. It's like, oh, now I've been infected by this thing 3 times. So clearly whatever I was doing wasn't good enough to stop those infections. So now I'm going to commit, more resources to really make higher antibody levels for longer. And so that's what I was referring to with like the tetanus vaccine. After 2 doses, you make antibodies for a little while, but not that long. But after the 3 doses, you make them for like 30 years. So my bet would be this is a vaccine that's going to end up being a 3-dose vaccine for the RNA vaccines, but is probably then going to be good for like 10 years. And there are different opinions on that right now, depending on, again, who you talk to. But I think that's a reasonable estimation.
Okay, well, thank you so much, Dr. Crotty. We really appreciate you taking the time and sharing your expertise in this area with so many questions and information out there. So we're glad to have you're sharing your knowledge with our team members. And thank you, Dr. Tassin. We'll have these questions that we didn't get to available. We'll send out the recording, and if you have any follow-up questions, please, you can set up a one-on-one meeting with.
Oh shoot, I didn't answer a couple of the pregnancy ones, right? So there was the
go
pregnancy one, right?
Sure.
Oh, does the RNA vaccine, gather in the ovaries, or does it cause inflammation that affect pregnancy? So I did briefly say it, in my talk, and I saw a question that was, are there studies about pregnancy? So I referred to, in the slides, there was the Associated Press article referring to a publication in the New England Journal of Medicine that was a real observational trial, a study of looking at pregnancies, and it was totally safe. And again, there's a ton of misinformation out there that's totally just fear-mongering and people making stuff up. No, the RNA does not gather in ovaries. No, that's from a totally different, unrelated study in a meaningless species. It's just not relevant. I would say the best easy to follow information on COVID vaccine safety for pregnancy is a woman named Vicky Mail on MALE on Twitter, and she's been covering the pregnancy topic from the very beginning, and she's definitely an expert in it, and she's seen every possible question that people have asked, and she's had answers for them. And so I would suggest following her on Twitter, which you don't have to have a Twitter account to do either. You can just type it into Google and it'll show you some of their biggest tweets. You don't have to actually log in or anything if you don't want to. But yeah, there have been full-blown high-quality studies that have found there's no negative impact of vaccination on becoming pregnant after vaccination, and it's totally fine for the fetus, and it's totally fine and good in during nursing. And again, the CDC has shifted from just saying it's okay for pregnant women to get vaccinated to recommending pregnant women get vaccinated, because there have been so many pregnant women who have died from COVID-19. And there's been an unusual number of them who have ended up in hospitals, in part because they were holding off from getting vaccinated. COVID-19 infection is much worse for you and your fetus than the vaccines. These vaccines really are very safe. All right, I'll stop there. I know we went over, but since that one had actually been asked in advance and I hadn't gotten to it, I felt bad. So there we go.
Thank you very much, Dr. Crotty, and thank you, Dr. Tassin. This was a very, very enlightening conversation. So we appreciate everything. We appreciate everyone who asked questions. Again, if you have one-on-one questions, we have made some of our physicians available to meet with you one-on-one privately. You can ask your questions there, but we'll also answer these questions in an email we'll send out with this recording. So thank you very much, everyone. Have a great rest of your day.
Thanks.
Bye. Thanks for having me.